Tapas. So, good evening, everyone. Today, among us, we have faculties who are most prolific and accomplished in the field of critical care medicine, and they have graciously agreed to share their knowledge and expertise with us among the bright and young minds of this country. The DMB students, the DM students, the IDCC students, this is for everybody. Amongst us, we have Dr. Tapas Sahu, who obviously needs no introduction. He has been successfully running this course for more than 1 year, and we have many success stories to share today with you regarding this top course. Dr. Sanant is there from joining from Australia. He has been working relentlessly with sleepless nights, thanks to the time difference, to ensure that finest and quality teaching experience is delivered to all our dear students. And we have very prolific faculties all over the country. Let me take this opportunity to welcome Dr. Subba Reddy from Apollo Health City, Hyderabad. Dr. Swarna Deepak from Apollo Hospitals, Hyderabad. Dr. Manjunath, he's not here yet. So Dr. Manjunath will also be a part of this course. He's from Manipal Hospitals, Bangalore. Dr. Gunadhar sir is also here from Apollo Hospitals, Navi Mumbai. Dr. Akhilesh, Dr. Shantanu, Dr. Ketan, they are going to be a part of our course as well. Dr. Bishwa Vikas from Utkal Hospitals, and Dr. Sautik Panda from Woodlands Hospitals. Dr. Rajesh is here from Apollo Hospitals, Vizag. So this is our esteemed faculty, and they have gone through a lot of pain, and they graciously agreed to give their time to share their expertise with us. So students, I request you to make full use of this course. Dr. Tapas is going to walk us through the course, that what is expected out of our DNB and DM students. And then Dr. Sanath is going to break the course and explain to us that what will be covered in the top course. So I hand over to Dr. Tapas.
Thank you, Dr. Mona Lisa, for discussing the whole agenda as well as the welcoming our faculties. So I would be starting with the introductory class related to the DM and DRNB. What should be the approach, what should be the expectation, and what should be our whole agenda of discussing this type of course. So I would be very short because there are many faculties who will be sharing their own experience rather than discussing the thing what we know. So welcome, friends. We started this course and this initiative almost 1 year before, and we all know that whoever right now is with us right now as delegates or faculties, we all are brilliant because we are have devoted so much of time in our education, both in our specialties, then super specialties. Now we are practicing somewhere or other, and also we are doing many residential programs like the DM as well as DRNB, and also IFCCM, PDCC, and many critical care exit exams in India as well as abroad. But the thing is, we still have a lot of things to do, lot of things to learn, and that's why we are here, and we are here to help you. So this day would be remembered because we are here with many faculties who are the national icons as well as international level also. They are well acclaimed, and they would be sharing their experience as the teachers, as the faculties, and finally the examiners, because they are many of us who are the faculties today. So they are the real examiners, and they have taken the examination last time from the candidates who have appeared the DM as well as DRNB. And also they are the regular examiner in our ISCCM initiatives like the IFCCM as well as IDCCM. So definitely they would be sharing how they want the candidate to appear, answer the questions, and how they should be confident enough at the bedside, so that it's a easy affair for the examiner to give them almost 70 to 80% marks or more than that. So with that background, we know that satisfying the examiner's expectations as well as scoring this type of 80 to 90% marks in any of the critical care exit exam, which involves so many specialties. It's not only related to medicine, surgery, or any other specialty what we are reading. So it's a multi-specialty involved course, or the residential program. So it's not easy, but definitely with proper guidance, proper approach, and getting the experience from others, it would be not that difficult if you will be going through the proper approach. So that's the reason why we started the course, and the reason why we are so worried that in India, at least in structured program, which would be covering the whole theory, practical, as well as the OSCE, that is not there till like we were the fellows, we were the residents. So then when we cleared the exam, we had like the fellowships at the national as well as the international level. So we thought maybe doing something and bringing all the things in one basket would be very useful for the candidates, for the trainees, because nowadays critical care medicine is ever evolving and now it is entered into the super specialty arena. It needs focus, strategy, and practice to be expert in critical care medicine. The examinations are also becoming very comprehensive, and we need to have proper planning to appear and pass. It's not so easy. It's right now in the format of any international level exam. The preparation needs to be guided, and we need to start it very early for better success. Now, there are many hurdles as trainees. What we normally like get across from our candidates, there is no structured course format in DNB or DM till date also. We have gone through, we have researched all those like the curriculum also, but the curriculum is there, the structure is there, but nothing in the way the candidates should start from day one. It's not there. Now everybody is having the hospitals are having academics, but there is heterogeneous academics in hospitals. Maybe the top sort hospitals where the faculties, they give more importance to the academics. Yes, it's there, but many of the hospitals right now, there is mushrooming of the hospitals which are getting the DRNB, but they don't have the academics. Maybe they don't have the experts also to teach their candidates. I think everybody will agree with me, all the respected faculties here. The hospitals, they have workload, they have volume of patients, but for like handling that, we have to be also educating our trainees. But that I think there is some like disconnection. We do not know what to read. Moreover, I would say what not to read, because sometimes we normally like involved in like not getting all the materials, downloading it, because it's available freely right now. We have so many Telegram channels, we have so many like the ebooks that is there in our hard disk, but hardly we get time, or if we get time also, we sometimes focus on the things that we do not want to read, or maybe that is not useful at the bedside. We have now more focus on the clinical management, because the DRNB is more like in the corporate hospitals where clinical management supersedes over the academics many of the time. And we do not have right now guide or mentor anymore who holds hand, just like in our MBBS days or in our like the training days in maybe 10th or like after that, who would be trying to teach and make us smarter professionally. We do not have enough time also. Maybe in our MBBS days, in our PG days, we were getting time to read in the library. But nowadays, I don't think we have time to study, because there are so many things right now we are doing along with our family, along with like we are also aging. So definitely it's not like 10 years before how we were reading. So we need something that should help us in making this job easier. So with that background, if we will not do it properly, something would happen, and that we all know it would be having suboptimal outcome that we do not want. Maybe that's the reason why we have to be like firm enough, we have to strong enough to face this type of exams with confidence. We cannot accept defeat at any time. So let's dig deep into DM and DNB curriculum. It is extensive. If we would like analyze the DM and DNB curriculum, it's not so easy. We need to cover each and every specialty. Maybe it is gastro, cardio, nephro, neuro, all the systems. From medical patients to the complex surgical patients, that is again another thing that is not in our like the medical super specialty or surgical super specialty. Here we have to be master in both medical as well as surgical also. Now we need to read physiology also. I would be saying It would be also anatomy also, pathophysiology also, and we need to also manage the patient well. Also, management is not only related to disease, rather, if the patient gets complicated, we need to also manage the complications. Like over the top of that, we need to also counsel the family. Communication part is also very important. We need to be master in all organs. We need to be also very sure about the monitoring part. Again, the advanced organ support system like ECMO, IABP, that also the trainee also need to like be sure enough. And along with the management or clinical part, we need to also learn the ABC of ICU infrastructure, administration, and also working in a team. Communication part is very important. We need to also pass the 3 years of our residency with stress. Also, sometimes we get burnt out. That part also has to be taken care of. And finally, it's not only about the clinical, rather, we need to be also very sure about the literature. What is the thing right now happening all over the world? Updates. We need to be also access the free online materials, as well as we need to also critically appraise many things that what we are doing at the bedside. With that background, we need to know certain textbooks which are very important for our training period, the resource materials, what we need to choose, manuals, handbooks, practical books. Definitely, there are many online resource banks that would be useful if you will start preparing from day one of your training curriculum, or like your DM or DRNB or ITCCM or IFCCM. We need to clear your your concepts along with the guidance, apply the theory into practical, and definitely you need to divide into the theory part, then the OSCE, that is the objective structured clinical examination, and also you have to also go through, because you need to also clear the theory, and that for that reason you need to have at least 200 to 300 questions of previous years, because that is the normal format. Maybe people will say that it's a like no old format, but we have all gone through that phase. You need to go through those questions so that at least you have the ready-made answers already you have like thought about before entering into the examination hall. So if the question gets repeated last 5 years, last 10 years question, definitely it would be like a cakewalk, and you can immediately like put all those like your like the things what is in your mind on the paper. Now for that you have to learn, you have to remember many things, you have to apply into your clinical practice, as well as you have to repeat the whole thing to just like get the things embed into your mind. Now for that reason, what normally like we advise, try to learn something about everything and everything about something. Now that is difficult. What is this everything and what is this something? It is very difficult. It differs from person to person, but for that it is this type of course, this type of faculties who have like tremendous experience over years, so they would be guiding you that yes, these are the everything, so you need to know something about this everything, and these are the something. For this you have to know A to Z. So that is the crucial part for preparing for this type of difficult critical care exit exams. Now for the clinical management, what we advise for like the DM and DRNB from the day one, or maybe if you are into the final year, at least till now you have the time. So you need to have a strong theory background. You need to have good exposure to cases, bedside procedures, and you need to do it maybe under supervision. But yes, you need to know. It cannot be only theoretical. You cannot go through the YouTube videos to learn about these things, because sometimes the examiner gets the hint that yes, this candidate has not worked at the bedside. He or she has mocked up the thing. Maybe he or she is right now only telling about the theory part, but when I'm trying to see that this person is able to examine the patient at the bedside, or doing some maneuver at the bedside with the ventilator, or to at the like no with the arterial line, you would be just not getting all the things connected properly. Now you need to also apply the theory knowledge for management of patients, also how you are handling the complications. So it would be not a very easy thing. If you have managed it in your like your training curriculum, definitely you can show that confidence in front of the examiner that yes, I am confident enough to manage this type of complications. If something has happened, this is the way forward, and I would be like doing at least justice to the patient properly. So in short, it has to be bench to bedside. There are many resource materials. I'm not going into detail. We all know now it is era of internet. We all get all the resources available, what is there in the market or in the internet. Maybe you need to choose one textbook as a whole, and you need to like read that rather than multiple books. It sometimes get confused and you will be only reading those things which are not very fruitful at the end. So maybe Irwin Rippe, maybe the John Louis Vincent, this is a new edition has come. Then maybe it's a Perillo book or it's Oxford textbook. It depends on your preference. Now there are many standard manuals or short textbooks, depending upon the organ system or the problem oriented approach, like the ventilation part, the ultrasound part, the dialysis part, the non-invasive ventilation part, trauma part. So ISCCM has a plethora of books related to each of the table viva or like one troubleshooting area. So you can choose those books and go through that, because that is the area where you need to be very sure, because the questions would come straight from that type of book. So you need to also have access to the important journals that is happening, what is right now the update. And these are the 4 standard journals what we normally recommend. One is IJCCM, one is ICM, that is by the European Society, then the SCCM, Critical Care Medicine, and finally NEJM, which is the most favorite one and having the most important impact factor. There are also from the ISCCM as well as some standard textbooks which normally guide us. Maybe the update books every year published by ISCCM, Washington Manual, and also some of the the top authors who are helping the candidates to prepare for the final exam. There are many website or online resources. Again, we need to be very aware of all these things. What is the deranged physiology, life in the first lane, internet book of critical care. There are many on-site right now things are happening, online things, that is Radiopedia, ECGpedia, YouTube. Many podcasts are available where you can go through, you can just listen to the important troubleshooting things that you normally get at the bedside, and that is really useful. I started listening to this podcast, which is making your time also invested in a good way. Like you are driving also, you can just listen to all these podcasts, but rather you should drive safely. Not I am saying to devote your time in a in a harsh way, rather you should use it in a proper way. Now coming to the question banks, I have already told for the theory part, you need to have at least 10 years questions with you. And those would be the DM question bank as well as the DRNB question bank. And you can see here the December 2021 AIMS question paper. This is the real question paper. And you can see how they have divided into the 8 questions, and each question is 10 marks. So you need to have all those questions. We recommend that you make it system wise and start preparing these questions and make a short note how you would be addressing, how you would be writing in a 2-page or 3-page format for each question, so that you will not be missing the important points. Rather you would be justifying your answer, and the examiner would be very happy to go through the answer papers and scanning that yes, this candidate has given importance to all the important parts, rather than writing 10 pages of no use or 1 page where nothing has been mentioned how to manage or how to go ahead with the question. For the DNB SS, it's not only about the final exit exam. Now DNB or DM, they have every 6 months or every 3 months have the FAT exam questions. So that also you need to be thorough, because these marks are also carried forward. And finally, when at the time of critical care exit exam, the final theory exam, so these marks are also having some importance. Maybe 20%, 30% marks are right now added to the final mark. And you can see it is the DNB SS question paper, very recent 2021. And very standard questions are coming: acute liver failure, this is stroke management, ventricular tachyarrhythmia, antifungal, some procedure related to tracheostomy, then some troubleshooting related to difficult airway, some biomarkers. So many things you have to make it in a very system wise, so that you can go through from the standard textbook, some updates, some literature, and make your own note. what we normally recommend. So just keeping those questions, this is a 2021 DNB FAT question paper from AIMS. This is the paper 2 questions. Now coming to the exam format, I will be making it in next 5 minutes. I will be finishing. So normally last time, what we gathered from our own candidates from top. So there were 3 papers. First paper was related to the basic. Second one is the clinical management. And third part is the advanced or recent advances. Sometimes they can change it to 2 papers also, but last time it was 3 papers. Now, coming to the practical part, clinical was long case 2, short case 2. Again, center wise and a year wise, it may vary. So it's not a very fixed thing, but what was done last time and how the examination format was, this is the 2 plus 2. Now, the table viva, what we again got information from the candidates who were successful, and also the examiners are with us also today. So they would be sharing their own experience, but the table viva can ask anything. It's not having any format like the edict 2, where it is only the 3 tables. You can say it's the DNB as well as the DM, they can involve anything. They can ask you related to the instruments, they can ask you about the equipments, drugs, fluids. They can tell you to like go at the bedside and do some maneuvers on the ventilator, like do the first flush test in the arterial line, data interpretation, graphs and curves, critical appraisal. Quality is one of the most important table right now. So what we gathered experience, the candidates were not very thorough about the quality part, but last time there was a special table related to the quality in the ICU, and communication part carries almost 20% of the total marks. Breaking a bad news is also one of the like most favorite among the examiners, how the candidate is explaining to the family relative. So these are the things normally being asked in the exam. Now for the theory, what we suggest, you should have chapter wise high yield topic preparation covering the whole syllabus. It cannot be possible that you start from like page number 1 and end up with 1850 page of urinary pay. It cannot be possible. So you have to divide that. The cardiology section, I have to prepare for the theory part, these 10 questions. So, and moreover, 90% chance is that these 10 questions would be repeated. So that is the key to success, and that would save your time, rather than if you would like make questions or like your preparation for all the like important things what is there in cardiology, maybe for the final exam it won't be like productive. You will be wasting time, and there are a lot of things you have to cover. Now it has to be concise when you like write on the like examination hall. It has to be concise, crisp write up, and also the time factor is also very important. It will be 3 or 10 questions, so you have to again divide the time properly so that question number 1 gets the same importance like the question number 10. So it cannot be like that question number 1 you are writing very fine, but in the question number 9 or 10 you are hardly giving 5 minutes time. So your mark gets reduced in those 9 and 10 questions. Now coming to the question format, it should be algorithm based and schematic way, and some innovative format that you should like have on the question, like your answer paper, that would impress the examiner, and definitely you will get very high marks in the like when the examiner is actually giving you the marks. Now we have something related to that, some like unique STEM approach. Dr. Sanand would be discussing that. I am not going into detail, but yes, like it's a question asked in the AIMS December 2021 paper 1. Describe the mechanism involved in improvement of oxygenation in prone position in intubated and unintubated patient. So that was the question related to the prone position. So some candidate, like one candidate can write about the all the things, important things in like 3 pages and finish it. But some smart candidate, and this is the format being utilized by the candidates, international medical graduates. So what we gather, that if you make it in a STEM approach, you can write down in 1 page also, and the main important points you are actually highlighting. And it should start from the introduction part, some like troubleshooting, then some like mechanisms, some literature review, and finally your take home message or conclusion. So that would be in 1 page. The examiner would be so happy to find everything that he expects from the candidate in 10 minutes to 15 minutes time of like the examination. because hardly the examiner has time of like going through scanning the papers and reading the all the 5 pages or 10 pages of essay. So that is the normal approach what we recommend. Coming to the practicals, again, if you clear the theory, then only you are eligible for the practical. So that is rule number 1. So for that, you have to first clear the theory. Again, that is very important for this type of 3-year DM or DNB exam. Now, for the long case, we would be again listening to our successful examinees. They are also with us. So just in short, it has to be bedside. Normally last time 45 to 60 minutes for the examination was there, and around 30 minutes to 1 hour of drilling session. Bedside, sometimes the examiners also ask the candidate to come to the chamber, and there will be like 3 or 4 examiners over a cup of tea. They can like ask you anything related to critical care, related to that domain. Maybe that domain is totally out, and they would be asked something related to some complicated domains further. So you, for that you need to have in-depth knowledge, and they normally assess in a like paper format the presentation skill, the clinical acumen, and how you are actually going with the narrowing down the diagnosis, the differential diagnosis, finally defending the skills, how like the examiner is asking some question and you are defending your answer, and the confidence, and how finally you are summarizing the whole case, the scenario. That is also very important. More important is how you are managing the complications. You have to also explain or sometimes narrate about the evidence behind what you are telling. ICU housekeeping, though it may not be part of like that domain, but they can ask you anything related to fast hug BIDS, the normal ICU quality, something related to communication and breaking bad news. So long case, they can ask you anything, everything. So from my side, I would say, if in long case, you can show that yes, I have worked in my hospital, in my ICU for 3 years, relentlessly, sincerely, and with lot of efforts. So that would be like the examiner would look at you, and he or she can be like, no, sure, yes, this candidate should be passed. So that should be the idea. Now for the short case, last time it was 2 numbers, or that can be also one single one, depending on the situation, the number of cases, 15 to 30 minutes each discussion. And this can be normally related to a single organ. But again, I asked the candidates, they were saying like it's not always a single organ, that can be also having another organ also involvement. No fixed format. They can ask again anything related to that case. Again, for that you will be getting the summary, then you have to go through the paper, something related to that. Not going into detail. Table viva, we all know. Again, I'm not repeating. It can be anything related to what we do at the bedside, how we are actually going ahead with our drugs and fluids, then the graphs and curves, then the X-ray, focus, CT, MRI, the videos. They can show you the like normal 2D echo video. They can also tell you to make like the windows in front of them in the real patient. And also in the final stage, they can go ahead with the critical appraisal, the communication, the ethics, end of life care, anything related to critical care. So finally, just to conclude, we know about the many things related to iceberg, but the success iceberg, I need to tell you, this is maybe something related not to the clinical part. Success comes here, but there are many things right now which we cannot see when a candidate gets a pass in the exam. Risk are there. We had so many failures in our training period. We had so many doubts at the bedside. Something were cleared by our examiner or our teachers at the bedside. Something were not cleared. We had so many criticism from our fellow colleagues, from our like other specialty colleagues, seniors. Disciplines, sometimes we maintain discipline, sometimes we are not that disciplined. Sacrifices we had made, everybody has made during our training period. We had so many rejections during our life, during the training period. We had so many late nights studying. We had so many nights also wasted. We were thinking to read, but sometimes some problems happened in the family. We could not read. And but finally, the persistence was still there for 3 years. And finally, if one word I would say, which is very important, that is hard work. Hard work definitely pays. and finally we can see the success at the end of the tunnel. So to just sum up, can we get all these in one basket? Though this basket looks very impressive, but in our critical care, it is very difficult to make this type of beautiful basket. And with all the things, all the resources that is useful and that can give you a sure short ticket to success. But what we promise, something is there, innovative, unique, and revolutionary, out of what we gathered in our 1 year of experience in 2 sessions. This type of course, I would not go ahead with the details of the course. I would like rather invite Dr. Sanant Kumar Das, who is the course co-director from Australia. He would be explaining the salient feature of the top course. Till the time, sit back, relax, and we have many things from our examiners as well as our examinees coming up. Hopefully that would be useful to you all. Thank you. Thank you all. Yeah, over to you, Dr. Mona Lisa.
I welcome 3 of my faculties who were not initially there. So Dr. Bishop Vikas Mahanti is there from Utkal Hospitals, Bhubaneswar. Dr. Manjunath has joined us from Manipal Hospitals, Bangalore. And Dr. Ketan has joined us from HN Hospital, Reliance Hospitals, Mumbai. So I'm sure their input is going to be very, very valuable to today's session. Now I hand over to Dr. Sanat Das, who is going to take us through this top course and tell us, break this course for us and what is it for us to gain in this top course. And it is something is there for everyone, all the DNB students, DM students, and IDCC and other critical care exams. Everybody is going to benefit from this course. So Dr. Sanat, over to you.
Thanks, Dr. Mona Lisa. I hope I'm audible.
Yes, sir.
All right. I'll start with my last slide. Thank you slide to everyone for hanging in there and listening. Tapas made my life easy because he has explained most of the things related to the exam. Now, the only question I need to answer is how we make it possible. My name is Sanant Das. I practice as an intensivist in Australia for last 9-10 years now. Me and Tapas go a long way. We have been training, or we trained together a few years ago, like 15-20 years ago. We're together, and we thought of this type of some sort of exam related, but at the same time can cover the basics of the critical care practice so that we can ease the life of the trainees. That's the main aim of this course. That's our top course with our esteemed faculty that we have gathered this time. Most of them are, or all of them are very experienced in the field. Most of them are examiners, so they know what the candidate is required to produce to pass the exam. They know how to get the answers out of them. So I really thank to them for their input in this course. In my brief presentation, I'll just outline the course structure. Rest of the things has been discussed by Tapas already. Now, just a summary of things. Now, critical care is a super specialty which is growing every day, every moment. And if you look at all the faculties compared to critical care, the critical care has progressed tremendously in last 10 years compared to any other faculty. So the demand, also the expectation from a critical care physician, critical care trainee who is going for an exam has grown up gradually. For example, when we appeared the exam, the standard of exam were still tough, but the expectation were different compared to what the candidates face nowadays. When I passed in 2010, I was lucky to see a couple of ECMOs in Apollo Delhi, or 3-4 ECMOs in Apollo Delhi, which was just coming up in corporate hospital. But now, I think every second tier city in India has multiple ECMO centers. So that's how the progress of intensive care has been for last few years, and the requirement and the expectation from the trainees have increased. So I don't want to threaten the trainee, but I want to tell that if they are going to pass the exam, the standard bar is very high for the exam. Nowadays, we expect the candidates to know everything so that we can safely accept these trainees as our colleague. This course is not only for the exam going candidates, it is aimed for beginners also, so that we can provide a holistic approach to the whole subject, not only the exam. Yes, exam is the last goal, but the preparation that builds up to the exam is not for weeks or months, it's for years that we do. So this is the course suitable for a beginner as well as a candidate who is going to appear the exam in next few months. Now, as a beginner, you get exposed to the concepts of critical care early through this course. You know what and where to study from, will guide you there. You get your basic concepts clear.
Your voice is not audible, Dr. Sanant.
First, can you hear now?
Yeah. Now it's audible. Yeah.
Sorry. So I was talking about get your basics cleared from the beginning rather than keeping them inside and then struggling at the exam. That's what we are going to help you with. Also, nowadays, the propagation of the technology is so much that you need to have a good network of people around you, so that we build the platform here. You know people through this course, so that we can rely on them, we can rely on them, and then ask about different things, about opportunities elsewhere. So this course provides a holistic approach for a beginner to be in the right place in the training. As an advanced trainee, you get to interact with the potential examiners and get the feel of the real exam scenario before the exam. It is suitable for all categories of training in India, particularly whether it is IDCCM or if IFCCM or DM or DRNB candidates. We have tailored this course so that it takes care of the theoretical part as well as the practical part of the exam, and also the basic needs for a basic trainee who is very early in his training period. It covers the particular parts of the exam, as Tapas was saying, the practicals, the OSCEs, how to answer the questions and all those things, and also importantly, the tips and the tricks that is shared by the faculties and the mentor. They are very, very important to pass the exam. At the same time, if you enroll into the course, you will have access to the master classes. There are at least 32 to 34 master classes, going up to 40 depending on the time that we have in our hand. So you'll have that access to those master classes. You can go back anytime and have a look at it. As I said, we aim to cover the theory chapter wise. For example, this is one of the module, the neuro module, neurology and neurosurgery. We divide the module into 3 parts. That theory portion that you or we want to cover, and then we mix and match the theory with the previous year questions. So we see all this theory part has to be covered with the questions. If something is left, we do extra on it, but definitely the previous year questions are covered in that master class. Then the other part is the OSCE and Viva part of that. This is a separate class that we do for practical aspect of the exam, which includes how to see a patient. If you get a long case on this subject, how to approach it, how to look at different types of Viva tables like neuroimaging, waveform, etc. So this is only about the neuro. Similarly, for cardio, there will be different. There will be echo pictures or echo station. For communication station, there will be scenarios and all those things. So we divide the whole chapter into the theory which is being taught or which is being explained in terms of previous year questions, so that you are able to counteract those questions, because there are a lot of questions that are repeated in the exam and you need to know how to write that answer. And also the other part of that chapter is the OSCE or Viva. As I said, Tapas was explaining, we have we do recommend a specific template for the exam. You don't have to draw that template, but the answer should be in a way that everything comes into your mind and you know how to channelize your thoughts to write the accurate thing that is required for the exam. You don't have to draw the diagram, but this is just only to show how the answer grid is divided in an exam. how you can get maximum marks. So whatever answers is discussed in the master class, we'll try to stick most of it, not possible always, but most of it. We'll try to give you a structure how to answer those questions. We talked about the OSCE already. Now this is the whole syllabus of the course. We have divided into multiple chapters. The sum total of around 32 to 34 master classes, which is going to be up to 40 depending on the time that we have. And each subject in ICU is mostly covered. Whatever is not covered, we assure that those chapters will be highlighted in one or two of the mock exam discussions so that we cover our ages completely. Now, this is the last slide that I'm talking about how the course runs. So if somebody enrolls into the course, we give access to some study material that is comprising of most of the landmark trials, review, and what you need to know at least for the exam. Those study materials are there. They're not notes, they are just study material, so that you can scan through them before you go for the exam, or you can make them as your study material for the exam. On the first week, this is the first week, we're talking about the introduction and few things around the course, and that will happen for 13 weeks. So we have 13 modules, you can say. Each week there will be a different module covering the theory and the practical aspect of it. Then there is a theory mock exam followed by the discussion of that mock exam. So you guys will be given questions, you will write down and scan back to us. We mark it, and depending on how much you score, you can have a rank on it if you want to, but that's always confidential to each other. Nobody knows what the other person gets, and we discuss the answer thoroughly in the discussion part. Then the practical aspect of the exam. So we have a battery of Viva and OSCEs that will be given to you, like a one-to-one interaction with the examiner that you can have. Also, the long cases will be one-to-one exam interaction with the examiner, but that's all online. So we have a format that we can simulate the exam. You can look at a practical patient, and then the Viva or the long case will run how in the exam it happens. That's pretty much the overview of the course. Again, I'm very thankful to the associated faculties. They are really good. They are extremely good. And I'm very, very thankful to them. Thanks, Tapas, for this opportunity to describe the course format. And thanks, Mona Lisa, for your support. I hand over to you. Thank you.
Thank you, Dr. Sanath. I'm sure that was very useful, and it was a very nice overview of the entire course. So now I'll take this opportunity to welcome all our faculties again, and I would like them to share their experience and what they expect from the examinees and what they want to listen in form of answers when they ask particular questions. And so I welcome Dr. Subba Reddy, sir. Sir, we would like you to share your experience being an examiner for so many years. I'm sure that's going to give pearls of wisdom to all our examinees today. Over to you, sir.
Thank you. Good evening, all. And congratulations to Dr. Tapas and Dr. Sanath Das and other people, Dr. Mona Lisa, for starting this very good structured exam course. I can say Dr. Tapas sitting in India, Dr. Sanath sitting in Australia. Starting this course, I can say this is like an Indo-Australian critical care course. And I can relate it to one of our courses, Apollo, with the Macquarie University. We have a tie-up, and Dr. Deepak and myself are the intensive care leads for the Macquarie medical students. We teach them. I know how structured the Australian exams are, and then like it is very difficult to clear the exam. Even now, even our exams like a DRNB and DM are becoming very tough now. This course is very useful, and thanks to both of them for including me as faculty. So coming back to today's session, I was giving exams a few years ago. Now I'm the examiner, so I'm sitting this side of the table. So I have seen both sides, what the examiner expects from a student. But I can tell all of them, if they do their 3 years honest hard work in the ICU, following all the rotations in the intensive care unit according to the DRNB curriculum, most of the students, without any problem, without much difficulty, they will clear the exams. And we started FNB or DRNB, FNB critical care long back in 2011. Until now, we have not seen any failure in our institute. I can say, I don't say that we are the best teachers, but the students are good. As Dr. Tapas said, they're brilliant. All of us are brilliant. So some areas I felt they're weak. The students are weak. One is statistics. So most of the students, they struggle to answer in statistics. Even for theory, if you see the last time, they asked for CTRI, that is Clinical Trials Registry of India. They ask long note. And then they can ask ROC curve, they can ask odds ratio, they can ask any statistics part. So they have to be thorough. They have to attend some workshops about the statistics. And basic anatomy is also very important of like trachea, tracheal blood supply and all these things. And pathophysiology is very important. And in recent advances, evidence, when you're in DRNB, the evidence, you must know the evidence and latest papers. And then this course is going to provide like some trials and then some papers, some review articles and all, I'm sure. And theory, time management is very very important. And when particularly you see there are three stems, and then for each stem there are marks allotted, and then you need to very brief, and then you have to answer all those parts, stems in that long note. And when it comes to practicals, already Dr. Tapas shared the type of cases, how they're going to discuss. But when you get a case like a stroke case, they may ask you complete neuro examination. You have to be thorough in neuro examination. So unlike IDCCM and all, in IFCCM, DRNB, you should know how to examine. They will ask you cranial nerve examinations. You should know. And there is no limit. They can go to any area, and then they can go to the surgical part, and then the post-surgical complications. They can go for they can even go into rehab, tracheostomy complications, rehabilitation. They can ask anything. They have to be thorough. Few cases, the long cases, they have to be thorough. And they can go for post-surgical complications, anticoagulation and all. Short cases can be anything like a weaning failure, a simple weaning failure they can ask, or a prolonged ICU stay, a patient with CKD with multiple complications, and then critical illness, neuromyopathy, they can ask anything. And then they can ask you to interpret nerve conduction studies also, that you have to be prepared. And all, like they can ask you to show in the practicals, and they can ask you to show how to use the ultrasound, how to do 2D echo, and hemodynamic monitoring tools. All the tools are very, very important. And when it comes to the articles review, as I said, again, these people, like many students are weak with a randomized control trial, meta-analysis, and then they can ask anything in the review articles. They won't they see the knowledge, how these students, they have done the thesis in DRNB, and then whether they can, they have to publish, and then whether they are having any idea about the publications, how to publish, which journal to publish, what is the impact factor. All these things are very important. And nowadays they're stressing more on quality and quality assessments, because by the time you complete your DRNB, you'll be going as as a director of any ICU or a consultant, and then you'll be managing ICU independently. So you should, and most of the hospitals are now NABH or JC accredited. The quality department is the backbone for your intensive care unit. They can ask you about anything about the quality, incident reporting, start right from incident reporting, or how do you do audits, or there's a missing morphine ampule in your intensive care unit. How will you do the audit? And how will you your internal audit, and then how do you root cause analysis for any problem, or if there's a iatrogenic pneumothorax in the ICU, how will you manage? And these things are very, very important. Of course, the ACLS, mechanical ventilation, all these things, we should not afford to make any mistakes in this. And then again, communication part, which is very, very important. They can act like the examiners can act. They can give a brain dead scenario, brain dead patient in a scenario, and then they will discuss how do you convince, how do you talk about organ donation, or again something like iatrogenic complication happened in your intensive care unit. How are you going to communicate? How are you going to convince the attendants? These things they're going to stress, and these are the important things. Thank you so much, and then I'll be happy to answer any questions in the chat box later. Thank you so much.
Thank you so much, sir. This was very beneficial, I'm sure, to everybody. Now, I would ask Dr. Swarna Deepak to speak a few words to guide our students.
Good evening, Dr.
Just interrupting. Sorry, Dr. Subbareddy, do you think the DM as well as the DRNB, the exam standard is right now almost matching any international exam like related to critical care?
Definitely, it is on par with any international exam. Here, in international exams, the time is very crucial. Like when you give EDIC exam, you don't have much time. If you know the answer, you'll within that minute you have to answer. But here in DRNB, they will give time, but you should not take too much time. But they are going to thoroughly examine the student. This is on par with any, because this is a 3-year course.
Yes. Yeah. Thank you.
Thank you, sir.
Dr. Deepak,
Okay,
please.
Dr. Sir.
Yeah.
Yes. First of all, thank you, Tapas Bhai, and Tabai, and Madam Annalisa. Good to see you all. And as I think it was very clearly told previously, I think every student here who is listening to the class, I think they most certainly are going to pass, and they're going to pass with flying colors. But only here we are good there to just fine tune their abilities, maybe just to structure it and do it with much ease rather than a bit of stress at the end. Okay, it's not only about passing it, but it's passing easily, passing with comfort, and enjoying your subject. That is the whole point. So as clearly told by Dr. sir, so one thing is you need to plan in advance. One thing I saw in most of the students are they don't plan it. So at least for the last 6 months, no, you need to be very clear. In fact, if you have this kind of structured courses, maybe they'll help you in planning in advance the 3 years. If you could plan 3 years, that is the best way. But if you could not, at least plan for the last 6 months and you pace yourself. And I would always tell my students, no, to master your difficult topics first, leave the easy topics, which, for example, for me, cardiac may be easy, but for me, statistics and maybe the journals and research may be difficult for me. So what I would do is I would concentrate more on the difficult topics first, try to overcome that fear factor with them, and maybe the easy topics, no, you can teach your students, teach your maybe second year. If you're in the final year, you can teach the second years and first years, or maybe keep on practicing the teaching habit. If you don't have any doctors with you, keep teaching the nutritionists, keep teaching the dietary nurses, but keep on teaching something. That would be really beneficial, and we actually will become more fluent in the exam. And the exams will definitely identify who is a confident person, who is a person who just mugged up in the end. I think it is very easy for any senior examiner. And once you plan it, I would suggest you don't read too many books. I try to find some books which you are comfortable and which are reasonably standard. And don't collect too many. I've seen students collecting entire iPads full of a lot of articles. But make sure that you have a specific data which you want to revise at the end, and try to mark your things which you read. Okay, try to make it simple the second time, and when you're reading for the third time, it should be just a revision of it, and always revise the topics which you read. And without revision, no, obviously you're not going to remember anything in the first article. Make use of that time very clearly. Second thing is, just before the exam, you have a separate plan for one is for theory and one is for practical, obviously. And obviously, you need to plan separately for it. But if you have a good theoretical background, your practicals also will be easy. And one thing, as a person with a general medicine background, what I find in the students with usually in these present scenarios are they keep on reading advances, they'll read lot of articles, lot of recent trials, but they'll forget simple bedside clinicals. If I ask you to just demonstrate the Babinski, maybe a plantar's reflexes, most of them may not do it in a right way. So that at least for a basic clinician, you may not be as equivalent to as a DM neurologist in examining it, or maybe you need not find a advanced murmur, rare murmurs and all. But the basic clinical skills: how do you auscultate? How do you elicit the major signs? These any senior examiner expects you. And especially in a critical care, no, you need to identify and at the same time try to diagnose and at the same time manage it simultaneously. You need to develop the quick reflexes. For example, in the exam, maybe you have a senior examiner like Sumit sir or Pradeep Rangappa, one of them at the bedside, and you have a case on ventilator. They may need you to actually elicit the reflexes, elicit the clinical findings. At the same simultaneously, they will want you to identify the ventilator graphics, maybe monitor the arterial line waveforms. They expect everything, and if you cannot fake them, so they'll easily identify it. And this bedside clinical skills won't come you in the last 3 months or 5 months. This is a habit you should develop learning over a period of 3 years. And you should, if you're not from a clinical branch, no, maybe I'm an anesthesia, or if you're from a pulmonology. And for me, from a medicine, you need to develop the anesthesia skills. So you identify your weak points and try to master these 3 years in a methodical fashion. And obviously, the exam part, the structured preparation that goes in hand, most of you are aware of it. But in the end, in the exam period, definitely, as I think the previous speakers has told, even I find that most of you actually falter at the communication skills. This is one thing you need to master. Journals and articles, you try to make a note of all the pioneering articles, important articles in that last month, last year. Try to actually jot down and prepare your own book of notes, so that in the end you can refer your own notes rather than go for a bottom line, or go for a light in the fast line. Communication skills, it is a very special skill. You need to practice on your surrogates. Maybe your junior can become a surrogate, or your teacher can become a surrogate, and try to develop the habit of doing a family counseling every day in your ICU. Sit with your seniors, sit with your consultants, try to see how they break the bad news, how they tackle with the difficult attendants, maybe a difficult other personnel. So you need to keep on training these things, which are not a routine thing to do. We are all trying to read something, go and vomit that one, try to get as much as best thing in that one. But these exams now, they are very special skills, and most of them are actually based on your Australian exams or US exams. No, so they're very objective. They'll test you, but at the same time, the best gratification is if you come out with a good scores in these kind of exam, then you'll have a lot of confidence. It is very easy to come out of an easy exam, but if you pass through a difficult exam, no, you'll have that confidence lifelong, and you can replicate in your later part of the career. And I'm very sure that all of you will do well. All the best.
Thank you so much, Dr. Swarnadeepak. So as Dr. Subba Reddy sir and Dr. Swarnadeepak said, most important is to work hard for 3 years and then last 6 months prepare in a very structured way. I think that is the key to success, which most of our examiners will agree with. Now I would request Dr. Gunadhar sir to speak a few words and guide our students. Dr. Manjunath has asked something in the chat box to help all the trainees. Can you please help us with your training year? Which year of training are you in? First year, second year, third year? I think that will help us guide you guys better. Over to Dr. Gunadhar sir.
Yeah, thank you, Dr. Mona Lisa, and Dr. Tapas, Dr. Sanath, all the faculties, examiner, and all my dear students. And as already, this is one of the very, very important topic, because many of us, they read a lot, but actually it is very important that which part of the theory or which part of the clinical examination you need to focus, and how to get well and do well in the exam. That is very important. So I'll just give you a few lines from my side. Like if you see, many of the times I have gone for the examiner for DNB specifically. What I have found that the students, they usually do better in theory. So most of them, almost 90%, they do well in theory. So I have hardly seen any trainee who has completed 3 years has done not better or done not good in theory actually. But what is the most important part is the practical aspect. So majority of them actually failed, or majority of them they actually fumble during the practical exam, because that is the area where your knowledge is really tested. So what the examiner likes to know in every aspect, whether it is theory, practical, OSCEs, Viva, is your core competency. So you should develop your core competency, and core competency is basically grabbing or basically developing your own knowledge. It is like what is something called as an integrated person or integrated trainee. So you should able to correlate things, you should able to know, and you should able to correlate each aspect of different examination pattern. That is what they like to see. So if I divide the exam into two broad aspects like theory, so most of you, I think there are a lot of resources available as told by Dr. Tapas and Dr. Subha, Dr. Deepak. You can read from the majority of the standard textbook, and what I suggest to follow a particular good textbook. Okay, not to grab too many of textbook and then get confused with your knowledge. But what is more important when you come to the practical examination? So practical examination, most of the DNBs and DM, they will have to face two long cases, two short cases, and which is very important. The long cases is usually 30 minutes and the examination and 30 minutes for the Viva. So in the 30 minutes, more important is the history taking and your general examination, examination of the surrounding, examination of the patient, and to summarize the fact, come to a conclusion of diagnosis, differential diagnosis, so that you can lead the examiner. That is most important. Because if you don't lead the examiner will lead you, then you will be in the trouble. That is the characteristics of a good student. You should be able to lead the examiner. That is what the examiner wants. And when it comes to the short case, it is a 15 minutes, just it involves the single organ system. So try to focus on what is being given. Ideally, it is either a liver failure, a kidney failure, a brain. It is only a single organ. And long case usually involves multiple systems. So as per that, you have to ideally classify or form your strategy. 15 minutes for Viva, you should be able to answer only the diagnosis, the management, investigations, and what is your goals, plan of care. That's it. In long case, you'll be asked everything, starting from your differential diagnosis, your core knowledge about your management plan, communication, ethics, investigation strategy, radiological, pathological. So that is you have to ideally segregate your long case into different areas. When it comes to the OSCEs, you will be having 8 to 10 tables of every OSCEs of different systems, whether it is a quality, whether it is how to read a paper, how to describe 2D echo, USG images, ABG, ECG interpretation, CT scan, MRI, like they want you to perform the bedside CPR, ACLS, BLS. Also, there is one table which describes the different biochemical parameters and come to a meaningful diagnosis. And these are the quick questions. So unless until you practice this quick question, at least every system you have some 10 to 15 OSCEs. I can say 50 OSCEs at least. It will be very difficult for somebody to come to the last moment and see an image and just form a diagnosis. So what is more important that you should practice. And the practice involves hand holding, and that can only possible with a good examiners who have already faced the exam, who know the students. I think this forum consists of all the senior eminent faculties who can already taken multiple exams and they know the students' mentality. So with this, I will not take much time. Just I wish you all the best, but attend this course with your heart and put 100% efforts. I'm sure that you will do good in your coming days. Thank you. Then this is from my side.
Thank you, Dr. Gunadhar, sir. That was very helpful. I take this opportunity to welcome Dr. Saurabh Taneja from Sir Gangaram Hospital. He has taken his time out to come and join this introductory class to help us guide our students better. Sir, I would like you to share your experience regarding examining the students and what you expect from a student as an examiner. Over to you, sir.
Hi, everybody. I am Saurabh Taneja. So, when you examine a student, you just firstly want that he knows all the basics. We're examining students or 2 years in IFCC, or they've trained 2 to maybe 3 years experience of genuine critical care practice. So the thing is that they should not mess up in basics. They should not harm the patient, and they should be practicing individually as a consultant later on. So that is what all the competencies and all the exams basically want to know in a student. So when you are alone at night and then you have a patient who goes sick, you can do the differential diagnosis, you can treat them, and you can not do any harm. That is the first thing that you want to know about a patient. So you will be from second year or first year, maybe third year students who are joining here. So what I would suggest is for the first year students is the best time to join the course, because you see all the cases, you read about all the cases, and then you learn about the cases. And then you have a lot of time, maybe 2 years, to actually go back and see the same cases again and again and again, so that the knowledge builds up. The literature that you read, the references that you read, it actually builds up. But once you're in the second year, then the exam pressure and thesis things comes, and the third year you want to just cater to the exam, then you want to do questions. In the third year, you should practice table vivas more and more. So table vivas, I mean, over the last 10 years, if you ask me, critical care specialist is expected to be someone who knows all. He should know CRRT, he should know. So there are a lot of things that are expected from a critical care specialist. And sadly, almost all the exams want you to be at the peak when you're giving the exam. So the only way is to practice and discuss, to train as a trainee as much as possible in the exam scenario, and then maybe answer the same thing when you are actually given a case in the exams. So if you discuss it amongst themselves, if you actually practice it with a teacher or a senior colleague or here in the course, it all adds up. I mean, it only slowly builds up. You cannot do it in 4 months or 6 months. I mean, the ideal way is to give at least 1.5 years, 2.5 years. And there's a lot to read, there's a lot to imbibe. And once you do it properly, I can tell you it serves you throughout your life. So just utilize the 3 years, have a guided mentorship, and it will help you out. Thank you.
Thank you, sir.
Doctor. Yeah, Dr. Mona Lisa, I would be taking 2 words from Dr. Saurabh Taneja's words of wisdom. One has to be that he has mentioned that you have to be a safe intensivist for the patient, because the examiner wants to know that you are safe to the the patient or not. The second important point, what I will add to that reliable and confident intensivist for the fellow or the colleagues from different other specialties, and also nurses. They want to be checking that yes, you are clarifying the doubts, queries by the nurses also, and the nurses also are confident that you are in the duty, the assigned stipulated time where you are at the bedside. So these things would make you a complete intensivist, and that would be seen by the examiner when you are appearing for the final exam. Yeah.
Very true, sir. Very useful. Thank you, Dr. Saurabh. Next, I would like to welcome Dr. Manjunath from Whitefield Hospitals, Manipal, Bangalore, to share his experience as an examiner and what he would like to expect from the examinees. Dr. Manjunath.
Yeah, thank you, Tapas, Mona Lisa, and Tanu. So this is, I think, it's one of the first course for all the critical care, the trainees. So when I was doing FNB in Apollo Hyderabad, I think now my boss like Subba Reddy sir is there and Deepak is there. So when I was doing, so we were so confused for the initially like few months and how to go ahead with the course. So what to read, like what not to read. So it was like so jumbled. But that's the reason. So I asked in the chat box, how many of you are in the first year or second year, I think, and I got only under 4 replies among 50 plus. Okay, it's fine. So see the first thing is, so, and you need to be like a very, the planned up for this like 3 years of course, the DM or the DRNB, and both exams, it's almost the same. So there is no change as per the university, the stations and all that, it might change, but the planning is and the most important. And there are, I think, like few of the like first year and the postgraduates here. So start doing and the planning for your course from now onwards, and whatever you see the patients and daily. So that matters a lot. So go and read those topics daily and make a notes of it. So that actually helps you out during the exams. And be disciplined, start doing the discussions like with your seniors and consultants. And see now I think among around like 40 plus candidates here, the few must have done some of the fellowships as well, and the 1 year of in the fellowship and the program there, your approach for the 1 year course was entirely different, and now intensive care, and you should go in detail. And if at all, if you compare the DM intensive care with the other DMs like cardiology, neurology, and all that. So our DM has got many other important aspects like communication and the quality, appraisal of the research paper, and all this. So these are some of the extra topics apart from intensive care, the topics and what you read. The bread and butter of intensive care, the topics are like sepsis and ERDS, the mechanical ventilation, the ABG, and all that. And you need to be thorough in the like basics of all this. And next comes the communication, the quality, appraisal of the research paper. For that, and you need to actually and work on with your skills like with your seniors. So please do discussions like with your seniors, and the time management in the exam for the final years now. So please, in your daily practice, take one patient daily, do the presentation of the case in front of your like seniors and the consultants. That actually ease your tension like for the exam. So you should imbibe this culture in your unit for daily. And about the communication skills, if you have any multidisciplinary meetings in your unit for the difficult families, for any patients who had like multiple issues and all that, please go and sit with your consultants in those multidisciplinary meetings, because these are the scenarios which actually we as examiners give you in the exam. So if at all, if you imbibe this culture in your and the daily practice, see, apart from sitting and studying and making notes, but and whatever your and the attitude for the DM or the DRNB, the 3 years course, no, that matters a lot. So it is not that no, I'll sit and study for the like in the last like 2 months or 3 months. We as examiners, we can actually assess you guys if at all if you have read for the like the last like few days. But your attitude in the exam and matters a lot. So be thorough and also be disciplined in your like 3 years of course, and keep studying and daily at least 1 to 2 hours, especially for the first year and postgraduates. And as Deepak has already said, the most difficult topics, and you need to read well, and simultaneously the basic topics like ERDS, the ventilation, sepsis, antibiotics, the drugs, and all that. All these are, if at all, if you're doing a handover or doing the rounds, and you can actually do the discussions with your fellow colleagues and the seniors. All this matters a lot. And so this course, so to be honest, if at all, if I see the like a course like a format, it has covered each and everything from the physiology till the evidences. And so when we were giving exams and we were so confused and what to concentrate and what to not to concentrate, but in this like 3 years course, and you should concentrate on each and everything here. So I think it will be very useful for and all of you to join this course, and to give you some and the overall the picture, the map for the intensive care exams. It will be better for you to attempt all this and see the examiners like a mind before you go for the exam. Thank you.
Thank you, Dr. Manjunath. That was very useful. So everybody is telling the same thing almost, that, you know, you should concentrate on the most important topics, concentrate on your weak points, and communication and quality are the things which we actually need to practice every day. And as Dr. Subhas Reddy sir said, that after you pass out from this exam, you're going to become an ICU in charge. So you are responsible for the audit and quality of your unit. So if you don't know and not answer these things confidently, then the examiner doesn't get the confidence that you are ready to be a critical care consultant. So it's very important to brush up on these topics. I would like to invite Dr. Vishwavikas Mahanti to please share his words of wisdom as an examiner to guide our students better. Over to you, Dr. Vishwavikas.
Hello, am I audible?
Yes, sir.
Okay. Very good evening. So thanks to Dr. Tapas and Dr. Sananta for initiating such a nice course, which I am involved since last 2 years. And thanks Dr. Mona Lisa for taking the initiative for facilitating such a nice course. First of all, I'm not going to say details because Dr. Subha Reddy and Dr. Gunadhar has highlighted all in great detail. But from my experience, I can tell that in 2012, when I was appearing FNB exam in the SGPGI, that time we have no idea at all, because we are doing FNB in the Indraprastha Apollo and we have sent to SGPGI Lucknow to take the practical exam, rather whole exam. So that time we don't know what is the exam pattern. So my experience was there. They have given me some patients it are on dialysis and he pulled the dialysis catheter. What you can do? So actually, I was not prepared at all for this type of questions from Dr. Arvind Baronia. So I was a little bit confused how to answer these questions. Even all the examinees who are attending this exam, everybody is confused. What is the exam going on? Like that. So now why I am telling this, because last 2 years in this type of course, now everybody before attending the exam, at least they know what is the exam pattern and what they are expecting from the examiner, because this is very important. Otherwise, the course is very vast and you don't know what they can ask you, especially like end of care, ethics, biostatistics. They can ask you everything from the exam. So why I'm stressing to attend this type of course, because here in the span of 2 to 3 months, they're going to cover at least the most important aspect of the every system in a structured way, which is very important. Because if you are appearing in the exam in the end of the month and June, and you are this is one type of revision for your exam. So this is not only for your DRTNB, and this is also helpful for your EDIC preparation. If you are going to appear for the EDIC also, this is also very important. And as everybody has highlighted, like the important topics like end of life care, ethics, biostatistics, especially which type of curve, how to read an article, and how to handle the critical situation, and especially the quality indicators in the ICU, which is very important to ask questions in the this type of examination. So you should be thorough about these type of topics. Also, the clinical examination part, Dr. Subha Reddy and Dr. Gunadhar has highlighted, because this is very important, because they may catch you your weak point, because most of the time we are just going, we are not touching the patient and we are not examining. So they may ask you how to like check your abdomen system, how to check the plantar flexor or extensor, all these things. So this thing also very important. So otherwise, I'm just stressing you, if you go through this course and be prepared at least a week prior, so it will be very helpful to guide and crack through any type of exam. Thank you.
Thank you, sir. Thank you for your kind words of wisdom. I would like to invite Dr. Ketan from HN Hospitals, Mumbai, and he has taken his time to join us to help our students. Over to you, Dr. Ketan. Dr.
Thank you,
Ketan,
everyone. Thank you, everyone. And thank you, Mona Lisa. Thank you, Dr. Tapas, Anant, and all the faculties. I think we have initiated a wonderful program, which is, I feel that is the way forward for the busy units who are working in a busy units of critical care. And I would like to share a different experience of current critical care trainees. Most of them are working in different settings, where the most common experience they faced, they come up with, if you ask them, how is your studies going? The first answer comes from them is, we don't get time to study. And or they don't know from where to start the study. And as rightly said by a few of the faculties, the academic program are very heterogeneous, and they may happen continuously or they may not happen sometimes, and it depends on the flow of the department. So this platform is a platform where you can make a discipline of your studies in a critical care. And my only advice is, you plan your year, like it is a first year or a second year or a third year. Every year has its own importance, and when you pass this exam, when you appear for this exam, every year work and experience and learning will contribute to exit this exam. So every year you make your schedule in the first year, how I'm going to involve my time in studying this exam for the exam. Now, my suggestion is don't be under impression that whatever cases you see in your unit will be the only the cases you will get in the exam. So our centers, usual centers for DNB exams are at different locations, and there is a lot of heterogeneity in the cases which comes. You might get a case which is 1 month in the ICU, and you are just given 30 minutes to go over those cases and make your impression. My suggestion is you should have a structured approach to any case scenario, because you may not come across same cases in your center. But if you have a structured approach for any case, I'm sure it will help you to lead the case in your way rather than an examiner's way. So every case you should have a structured approach. Remember important points, make the problems points, make the issues and the plan, and then deliver the answer. This will help you in overcoming any difficult case, whether it is you have never seen in your center or it is the first time you are seeing. So cases presentation is the weakest area where we have over a period of time we are finding it challenging for students to who are appearing for these exams. So whatever cases you have in your unit, make sure those at least you know thoroughly. If out of 4 cases, if you get one of those, you might go, your Viva may go in a right direction. But if you don't have, you're absolutely facing a new case, then you need to be prepared for that. Second is, we generally prepare for table Vivas at just before the exam. And there, what I find variation in every student, how they present a X-ray, how they present a CT scan, how they present the interpret ECGs. So those things will come with practice, and mind it, you don't have time there to think a lot about ECG or X-ray, and you have to be ready with the answer on spot on, and that too you have to be spot on. So practicing table Vivas, ECG, X-rays are the most important thing. And I believe that it happens very, it's very uncommon to have those kind of sessions in your routine academic. This platform will give you that opportunity that you are exposed to this table Vivas, X-rays, ECGs. Uh, Sometimes I have seen a simple ECGs or simple X-rays. Student fumbles to answer, and which are like a scoring for you. So my suggestion is keep reading at least twice a week or so that you are prepared, rather than reading 3 months just before the exam, taking a leave and reading for the exam. That will not help you in long run. That may help you to pass that exam, but that will not help you in long run or to pass any international exam like EDIC or any other exam you're planning to give. So my suggestion is also use the online resources, which you have plenty of them, and you can explore many websites to learn many things, because everything will not be taught in your academic center. So you have to be working in a 360 degrees for your exam, and start your preparation from first year, second year, third year, and then you will find this exam to be very easy. So that's what I wanted to convey.
Thank you, Dr. Ketan. Very true. Now I would like to invite Dr. Rajesh Kasimanti to please share his words of wisdom with us. Over to you, Dr.
For
Rajesh.
all candidates, Dr. Mona Lisa, before Dr. Rajesh joins us, sharing his own experience, we have the successful examinees last time, Dr. Khalid and Dr. Anwar. So they would be also sharing how they have faced the real exam and what are their experience from that examination. So we would be also having that. So Dr. Kasim Mohanty, first you should describe your own experience. Yeah.
Hello, hi, good evening, everyone. Thanks to Dr. Tapas for giving me the opportunity. So like many of us face so many exams so far, but every exam needs some sort of preparation. You can't prepare it like in a short period and you can give an exam. Before me, like many of our like senior examiners have spoken a lot about how to go ahead and what are all the difficult topics usually will happen in a critical care exam. I'm not going to talk about any of those. So I'm being the youngest in the group. So what I would say is I would like to share like what my head of the department, Dr. Arvind Borana, used to share. So the idea of any core training, any specialty or subspecialty training is to make people make decisions. So the idea is about making decisions. So as an examiner, what I would like to check any of my examinees or the candidates is whether they're capable of making decisions when the real situation comes. So that's what I would like to check in my students. And at the same time, of course, this decision making doesn't come with your few months of preparation or like few weeks of preparation. So the whole idea is you should have an long-term plan about your improving your decision making capabilities. At the same time, of course, every exam will have its own structure. So you should have an short-term plan, whether it few weeks to few months plan to give all the exams. As many of our previous examiners said, like try to identify your weaker areas and stronger areas and concentrate more on your weaker areas. Something like, what I would like to concentrate more if I'm again writing any of the critical care exam is one part is definitely research methodology, handling difficult situations, and of course, ethical dilemmas in ICU and end of life care issues. These are the must topics, and these topics will be asked to every person who's going to give the exam. So you need to be a bit more, I would say, experienced rather than have a structured answer, because you don't know what kind of scenario will be coming into picture. So you need to be ready, and it's like, on the spot decision making rather than to have any like, structured format. Of course, few scenarios might have a structured format. And at the same time, like communication skills definitely important. They are also not going to come kind of your weeks to months preparation. So you should have a long-term plan, like try to speak with your patient's family members daily, and try to look at, there's a lot of online guidance is also available for handling the difficult situation. And that you need to have a long-term plan rather than a short-term plan. And of course, research methodology and quality indicators of ICU, like, and once you become an independent intensivist, how you're going to handle or structure in an ICU. That also is important. One more area maybe which is not most core common topic of exam is designing an ICU, and then the HVAC system, like humidification, ventilation, and air conditioning of the system. Maybe that is one more thing, maybe kind of a bit tougher or unknown area which might come. So those kind of difficult areas, maybe we should have a long-term plan. And of course, for the short-term plan, like there are so many like materials are available, and of course this course is really going to help in terms of having a structured formula for all core clinical topics. But what we may not be able to make you master is something like these non-clinical aspects like communications, which you should develop on your own. And yeah, of course, I'll conclude again with saying what I would like to check is whether the student can make a decision when the situation comes. The decision can be right or wrong, but what you need to be is you need to make a decision and go forward. That's what I would like to check in the students and in the examinees. Thank you, Dr. Mona Lisa.
Thank you, Dr. Rajesh. Now I would like to hear from our last year students, and now they are going to be our faculty soon. Dr. Mohammed Khalid is there with us. I would like you to share your experience with us. How did you find our course, and how did you find the exam? and your words of wisdom to all the students here.
So,
Yeah,
so
good evening,
before
everyone.
that, yeah, I welcome Dr. Khalid. Dr. Khalid is our the trainee from BL Kapoor Hospital, New Delhi, and he is very intelligent and I would say that he has scored almost 80% marks in the final theory as well as practical. So one of
Wow.
the successful candidate in national level also. Yeah, congratulations, Dr. Khalid.
Congratulations.
Thank you, sir. Good evening, everyone, my colleagues, my teachers, all the faculties here. So, as discussed earlier, that a lot has been told like about the examination, that what we need to prepare and all. So they are all right. We have appeared for the examination, and the examiner are like they want the basics should be correct. They don't want to see that you played blunder in the basics like ECG, ABG, and all these things. This has to be mastered, like anything. And the rest of the things like quality, communication, statistics, your thesis, what you have done, you should be in and out. You should know all the things about it, because they ask about the thesis and we fail there. So that is going to give a very negative impression that you have done a thesis and you are not able to speak about it. And the scientific papers and the statistical analysis, what has been done, and ethics and quality and communication is a must in every case. They will ask everywhere, whatever, whenever they want, they can give a scenario about the any communications. And the ventilator, the maneuvers, the any maneuver they can tell to do in the ventilator. Echo they have given to show the window, and the ultrasound they can give the diaphragm and the lung ultrasound, anything like. So this all the daily work what we do in the ICU, it has to be done. That is a mandatory thing which they expect. And there are only 4 candidates in the examination, so they have 8 to 12 hours they assess you. So they will assess you in every aspect, so they have a lot of time. So we need to be prepared. We need to go prepared, like they can ask you anything. And the best thing is that I also started preparing late, so I got the top class. I enrolled in the top class. So earlier I was very much confused what I will do. I will be able to prepare or not. In very short time is there. We are the first batch of DRNB. But I really thank Dr. Tapas, Dr. Sananta, Dr. Mona Lisa, and all the faculty. They have given their 100%, more than 100%. Whenever we required any kind of doubt clearance, anything, they were there. So they had given us a mock theory exam, mock practical exam, and all the important articles, landmark trials, landmark papers they have given us. So we never expected that this much we'll get from the top course. But I really think that they have helped us in a tremendous way. So it's a we never can give that thanks to you, because I really feel nostalgic when I joined and now when I passed. So you people were there till the last moment. So many people will be there in the courses, they will disappear, they won't answer. But at the midnight also, when we have asked you the doubts, you all have answered. So that's a big thing for us. And you have all the structured thing, all the plan you have made. And almost I feel that in theory also, if I would not have attended a top class, I would not have been able to attend like 6, 7 of the 60-70% of the 60-70 marks question were there, which I gained from top class only. Or else I would not have able to answer that. So your course was actually like full. It was a package, what I feel. So this has helped me a lot. And I heard from a lot of people, my colleagues who have enrolled, they were also like feeling great that they have enrolled here. So, and this time I think you will be coming big and in a better way. So I really appreciate and thank you all for these things. Thank you, sir.
Thank you, Dr. Khalid. So 2 of these other successful examinees, Dr. Anirban Karmakar from Medanta Gurgaon and Dr. Anwar from Kochi. So they could not join in the meantime because of some emergency in the hospital. So Dr. Mona Lisa, we can now summarize everything, and without wasting further time, I think some of the delegates, if they have some queries, they can directly ask our faculties, and we can clarify them. Yeah. So I would request, Dr. Mona Lisa, please.
Thank you, Dr. Tapas. I would like to take this opportunity and thank all our faculties to take their precious time and join us and our students to help them through this journey. I know it's a tough journey, and with the guiding light provided by all our esteemed faculties, all the students are going to do really, really well. I would like to thank Dr. Subha Reddy, who took his precious time out to join this course, Dr. Ketan, Dr. Swarna Deepak, Dr. Rajesh, Dr. Gunadhar sir, Dr. Vishwavikas sir, Dr. Sanand sir, who is awake and, despite of the time difference, losing his sleep to help us. I would like to thank all our students who were patient enough to be with us to understand the top course. And believe me, this course has been designed to help you guys and to clear all your doubts and to give a structure to your exam preparations, no matter which exam you're going to give. DNB, DM, IDCCM, it's going to help you guys to bring structure to your preparation and help you guys crack your exams. If you guys have any doubt, you can ask us, else we would end this course here. I think there are no
Just
questions
at
in the chat
end,
box also.
if any of you have any query, you can just post in the chat box. We can take those questions, or else this is the recorded video which would be again be available for you anytime you want to watch, or any of your friends who have missed the presentation, the webinar, so they can watch this type of videos multiple times. We have many free videos in our website. So you can directly message us and we can directly allow you to watch those videos. Yeah. So I think we can end up here. Yeah. Oh, there is a question. Yeah. Yeah. So I request the faculty to take one question each, if possible. So there is a question, Dr. Mona Lisa, you can take those questions and
Yes.
our faculty can answer. Yeah.
Yes, so Dr. Rumaj is asking, usually we don't have time after being all day busy in ICU and after having frequent night duties. So how do we catch up with this course? Dr. Sanath, you want to help with this?
So Dr. Sanand, I think
I'm still awake, Tapas.
Yeah.
Anyways, so
What answer this thing? Excuse me, sir. Because I have been examining, I also faced this thing last year. So the thing was that I was thinking that I will be on duty. So how do I attend this class? So when you start and you give time, so a lot of colleagues are also there. They help you, you go and attend the class. So I have attended 85 to 90% of the class online, and I have never watched a recorded video later on. I tried to be online and attend the class. So it happens. It is a question that we are on night duty, but when you start attending the class, it happens. It's just a flow. When you start it, then everyone will help you. When you are studying, no one is going to disturb you in their duty also. Thank you, sir.
Yes, that's very true. You're going to find time and it's going to go with the flow. As your classes starts, you will find time to attend the classes also. And everything as a recorded version is available. So whenever you're free, you can go back and listen to the recording and revise your sessions also. I'll take the next question. Can you please suggest a book which we can read in first year as a first year resident? So any suggestions from all our faculty?
Dr. Subba
I
Reddy?
will suggest, so I'll suggest what I did. The Oxford Manual is a very, very good book to start with because it gives you the basic management concept. And probably the ICU book, Paul Marino again, for the first year I'm talking about. And at the same time, just refer to the websites, like you look at deranged physiology or look at life in the first lane. They may not be very authentic, but they have a lot of link there, a lot of video link there, a lot of podcast link there, which really clears the concept. So even from a very small thing like what is the vancomycin dose for this patient? So if you are in doubt, just browse it in those good websites and they will give you the clear concept, how the dose is modified, how should you dose it, and all those things. So very, very silly questions you can just type in a Google search and type at the site life in the first lane or deranged physiology. You will get a very authentic answer there. So nowadays the concept or the what we call tradition of books are disappearing. That's a sad part of it, but that's how the technology is, and you need to be at par with what's happening around you. So need to know how to browse a particular subject or particular topic from an authentic source, and it's a practice that comes as you grow in your clinical practice. So I would say very basic book like a Oxford manual or a Paul Merino to start with, and rest of the things you can browse around from the internet, because you have the phone always with you. You may not have the book always with you.
Yeah, I completely agree with him. We can take a small book and then thoroughly read, or you can take WOS Intensive Care Manual also is a good, you can read that book. And I can say the patients are your best books. You see that patient and then go back and read about that case and thoroughly, so that you will never forget about that case.
So, so one of the thing what I normally experience, and I have done it on my own in my fellowship days, I normally keep one short diary, or maybe like 10-20 page short notebook. Wherever I face difficulty in my patient, I just write down those things, and then during my off time, when I go home, go to the hostel, so I will be just looking at all those things, because you cannot like read one topic and finish it in 10 days or 7 days, because in ICU you have like multiple system patients. So one patient will be liver, one patient would be kidney, one of the consultant would be telling you about hepatorenal syndrome, the next patient when you are taking the round, maybe he would be telling you about the GBS, then plasmapheresis indications. So you would be confused. So the normal, like the way the best intensivist the what like I gather from my teachers, they say you write down where you are actually facing the hurdle, and go in your like leisure time and read that thing immediately in the same day itself, so that you at least clarify 50% of your doubt. Then during the normal course of the time, when you are reading the system as a whole, like liver, I can go into detail of the hepatorenal syndrome, the like the other like the complications related to the cirrhosis of liver and the complicated CLD management, something like that. So that is a way for the busy intensivist, because we cannot always devote of like 8 or 6 hour time just what we are doing in our MBBS days, because we won't get time. We will have our like hospital duty, we'll have our family concern, we'll have some like merrymaking time. So it's not possible for you to sit for like more than 1 hour at a stretch.
So can I add something, Tapas?
Yes, please.
Yes.
Yeah, so you have rightly told, basically we should consider that every day is an exam. So when you go to the bedside, think that every patient is an exam patient, and think yourself that every day is an exam during your duty time also. So then only you have to practice whatever you are supposed to do in the exam. You have to just examine the cases in the bedside in a similar manner. That will give you more and more confidence, and that is, I think, the key to success in the clinical areas. And of course, the theoretical part you can read from the books, but clinical part you need to daily examine at least 1 or 2 patients in the exam format from now onwards.
So the best way, what my teacher in Toronto has advised me during my training period, that whenever you appear like any of your like patient, if the ABG is there, think that ABG is coming in your exam. If you are having 1 month exam and you will get that. If you are like watching one CT scan at the bedside, maybe that CT scan is in front of you in the examination hall. Think about that, and then read or approach that CT scan or X-ray or that ABG or that ECG on the monitor and address all those things. Maybe you will utilize that time with your like colleague and discuss between you like the things. Maybe your teacher and you be the presenter, and the colleague will be like listening to your like what you are actually telling, and you can record also. You can record also how you are actually explaining to the examiner at that time, and that would be like the things what you are actually facing difficulty, how you are difficulty like facing in the connecting the dots, that would be addressed by watching the video, like how you are facing the difficulty. These are the certain things that would be definitely useful if you want to be very thorough in your presentation skill. Yeah. So we have Dr. Mona Lisa, we have also Dr. Santanu with us. Dr. Santanu Bakchi, he joined, but somehow his name was not changed, so we could not involve him. So Dr. Santanu, could you please share your experience?
Yeah, thank you, Tapas. Good evening to everyone. And as with the esteemed faculties and all, everything or almost everything has been discussed regarding the exam. What I would like to highlight or add or reiterate, whatever you say, is few things. One is there are two parts, as because the students who are enrolled in this course or who are going to enroll in this course, we will be appearing for the DM or the DNB final exam. So you will be having a theory part and you will be having a practical exam after successfully completing the theory part. So for theory portion, most of the cases or most of the questions will be coming from the cases you are being seen. So whatever patients you are getting regularly in your ICU, prepare those as your case. You will be getting the theory questions on that. But at the same time, don't forget to remember new bits, newer aspects. There will be some questions on those aspects also, like for example, artificial intelligence. It's being a very common topic being asked nowadays. So be prepared for those newer parts. There will be in all 4 papers, there will be 1 or 2 these type of questions along with your regular cases. So that part for theory. Second thing about theory is prepare your pharmacology well, because whatever questions you will be getting for pharmacology and all, those are your secret. So you can score almost full marks on those. So prepare that part well. And third thing about your theory is that you need to write answers what we got taught during our post-graduation as well as our fellowship days. So we got taught in a very simple manner that no need to write long answers, write in a systematic manner, write in on flow diagram, and write 1 or 2 pages. If you write sensibly, if you attempt all the questions, if you write sensibly in all the questions in 1 or 2 pages with a diagrammatic manner with use of flow charts and tables as much as possible, 99% possibility you will be passing in your theory. So that is not the more difficult part. I would rather suggest from my own experience also, from my friends and seniors experience also, that practical is the more difficult part, because there is no syllabus in practical. They can ask you anything. We have seen examiners who will ask if we are coming with a case of like some ARDS, and if I understand that you are getting ARDS well, so I'll switch my case to something else, some other topic. So practical doesn't have any syllabus, but that's not to frighten you. Rather, your preparation needs to be very structured. So remember, in your exam, whenever you are facing a long case in a practical, there will be 2 parts. One is the case management proper, and one is the medical management proper. So first, initially, they will go into the history and physical examination. There, they might ask you, they want to see how structured your history taking is. You need to go back to your graduation days for those, and you need to at the same time they might or they will probably surely ask you about some part of your physical examination that you need to demonstrate well. You need to show the signs and all that most of us has been asked during our long cases. So once you are good with those history and physical examination, you will be getting switched to the management proper. So once, even if you don't know the case, stick to your basics for a critical care management of a patient, be it a long-term patient, be it a short-term patient. So that way, if you can answer sensibly in those parts, then definitely you will be able to clear the exam for the long and short cases. And regarding the table vivas, I would like to definitely stress upon, particularly there are many students I was observing there from the first year. What we didn't do, at least I didn't do, is to put stress upon the critical appraisal of a paper. That is one thing. Second thing, communication. That is the second thing. And third thing, about your quality, like audit and statistics. These are the 4 areas. Communication is very important. Among all these, communication is the most important thing. You might pass or fail on that table itself. So communication is very important. And so along with communication, you need to be very particular or thorough, at least on the basic point of view, regarding statistics, regarding critically how to appraise a paper. That you need to do practice from your first year. You will be very comfortable. Definitely, you will be giving one paper, and you will be asked how to assess the paper, what are the drawbacks, plus points, strong points, negative points. Those things will be asked, and some questions about the statistics and the audit and quality parameters in ICU. So those areas usually we miss due to our day-to-day busy schedules in ICU. We do miss those areas. So try to develop practicing those areas from your first year itself. That will be easy for your final exam. That's all I would like to add.
Thanks a lot, Dr. Shantanu. Sorry, I couldn't add you because I couldn't understand the Zoom.
No, my
you
name was not there. I
Yes,
can realize.
yeah.
I realized it pretty late.
Yeah. Thank you. Thanks a lot for joining us, taking out your time to join us this evening. There's another question by Dr. Rumar saying that there are so many articles for one particular topic. So which one to choose from and where to read from? So I think Dr. Tapas, would you like to answer this for everyone?
Yeah, so it's a difficult question, Dr. Rumaj. We cannot be sure that these articles are the the choice of the examiners, but definitely you have to divide the domains, and each domain you have to select the landmark articles in the last 10 to 15 years. And the landmark article, the basis of making or assigning that it's a landmark article is very simple. It has changed the way the practice was before, and now the practice has been changed to the current the strategy. So if I would be saying ARDS, so the ARDS you would get almost 8 to 10 landmark articles. There are n number of articles in ARDS. Every day there is an article coming, but yes, the landmark article means it would be changing the way we started applying our knowledge in the ventilatory setting, and now how we are actually managing the ARDS patient. So in that case, it would be only 8 to 10, maybe related to the tidal volume strategy, maybe related to the prone position, maybe related to the ECMO, maybe related to the neuromuscular blocker, maybe related to the meta-analysis or the NEGM, the whatever the in the last 3 to 4 years that has come. So it you have to make it in your domain based, and you have to select and add up. So you have to add up. It cannot be like that. Yes, these are the 5 landmark articles and you have to be prepared. Maybe you can make up 7 to 8 related to each domain, get only the conclusion part and the basic idea behind the trial. And in the exam, they would be also sharing with you some critical appraisal when you will get one hard copy of the article, and you can go through in short time, scan it, and they will ask you related to that article. So that can be also done, but yes, it needs practice. It needs reading a lot of articles, and then you can get help from your seniors, your teachers, to make the battery of landmark articles for each domain.
Thank you, Dr.
Anything
Tapas.
from anybody who want to answer
Yeah,
this question?
I would like to add or rather say one more thing, that start practicing following few of the websites like your bottom line and all. That is very helpful in analyzing your papers, and you will get all the list of important papers also. So follow online resources, that will be useful.
The problem, Dr.
Hello.
Santanu, yeah, Dr. Manjunath, I will be just taking 30 seconds.
Yes,
With
yes,
the
please.
online, for a trainee, it's very easy for senior person to go through all those articles and check all those home materials, free online access. For a trainee, in their limited time of study, if they will start checking those articles in the internet, there would be n number of websites, and everybody, if it is the bottom line, if it is the Criti IQ, if it is the landmark articles, so they would be having on their own, they have made the landmark articles. So sometimes you lose your precious time only in collecting those articles, rather going into detail, going into the basics of appraising that paper. So the advice is to not get distracted with all those information in the internet, rather utilize that internet for scanning in short span of time, and getting the basics right, how to actually critically appraise the paper. Yeah, Dr. Manjunath, please. Yeah.
Yes. So Dr. Tapas has already said that you need to scan all the articles. How do you learn about scanning the articles is you should also to spend some time to read these articles. If at all, if you have one specific topic like a CLD, so if at all, if you have around 10 articles and with you, when you need to read all 10 of them and make at least 3 or 4 as important for your exams, and you need to highlight all of them and save it across just before the exam and revise them. So it's very difficult to tell in a landmark, and you should read this on the topic and only from this article. It's very difficult. Few of the articles, the complications, it might be and very good. And the approach for that, the scenario, it will be the different. So if you start reading, and you should spend some time in the beginning, so then you can assess the articles and then take over that. Okay, for this topic, if I read these 2 or 3 articles, it will be good enough. And you can like save it across, or take a printout, or save in the iPad or phone or anywhere, mark it and make a notes. These are the important things.
Thank you, Dr. Manjunath. I think we are done with most of our doubts. You guys have all our numbers, so you can personally message us also. And if you have any doubts, I would really like to thank all our faculties to take their time out in their precious schedule and be with us today. Again, Dr. Manjunath, Dr. Swarnadeepak, Dr. Subbareddy sir, Dr. Gunadhar sir, Dr. Tapas sir and Dr. Sanand sir, Dr. Vishwavikas sir, Dr. Rajesh, thank you so much. Dr. Mohammad Khalid, it was really nice to have you, to see you as a faculty on this other side of the table now. So thanks a lot, everybody, to join this introductory class and make this a success. Dr. Tapas would like to say the last words of acknowledgement before we can end this meeting. So
everything has been discussed in detail. Just thanking all the faculties. They are like so much like dedicated to our like commitment, and definitely they motivated us. And all of them are like experts in their like own area, and like at the national level as well as the international level. So we would definitely try to give you all the important materials as well as the inputs that is needed for coming up with like flying colors in your exam. So best wishes to all of you, and definitely keep in touch. We are there to help you. It's not about only our course. We are here to help you also as a like seniors maybe. And we from the 360 critical care, I would again take the opportunity to announce that we are also coming up with many innovative and unique academic you can say try what we are doing. And we are coming up with one for all of our faculties. We are coming up with one nephrocritical care review course for the first time in April end in Mumbai. And after the first nephrocritical care conference, now we are focusing on the review course. So that would be very interesting. It's a 2-day program, and almost all the initial program agenda and everything has been finalized. There are international faculties coming, and it would be hands-on problem solving, and most important, I would say, organ that is intricately associated with critical care, that is the kidney, nephro. So any ICU, almost 50 to 60% of the patients, if it is a multi-specialty ICU, the patient would be from the nephro side. So definitely it's a part which I hope, or I have seen that it is not a very detailed discussed in like not till date. So we are trying to raise the awareness, and maybe in future we would come up with the manual also, nephrocritical care manual, some like hands-on, some videos of short time duration that would be freely available to everybody. And we have also started in the line of the nephrocritical care society at the national level. So that would be one, like you can say, biggest achievement from India that would be represented at the international level. Dr. Gunadhar, if you want to share anything.
Yeah, Tapas. I think you should share the agenda with all the upcoming students, and because it will be one of the very interesting program, I suppose. So, one is hands on the machine and bets on decision-making ability for the nephrocritical care patients, like whether to initiate dialysis or not, whether how to do a troubleshooting on the live patients while the machine is going on, and many more. So it's a combined course for both the nephrologist DNB student and critical care DNB students, which will really helpful because it's a joint collaboration between Indian Society of Nephrologists and the Critical Care Society of Critical Care of India. So I think you should.
I am sharing the screen.
Yes.
So as Dr. Gunadhar has told, because this program would be conducted in Apollo Hospital, Navi Mumbai. So I'm just sharing this screen. So this program is actually the initiative of 360 Critical Care, and we would be conducting the first program in Apollo Hospital, Navi Mumbai. So the target audience, this is just a preliminary agenda. So many things would be changed, but the target audience would be the critical care specialist, the nephrologist, the DM, DRNB nephrology, the DM, DRNB critical care students, IDCCM, IFCCM candidates. There would be practical and theoretical aspects in the renal replacement therapy in ICU, along with the physiology of renal dysfunction, dyselectrolytemia, and practical management of various pathology related to kidney. So the plan is to conduct this on 21 and 22 April 23. So we have the international faculties lined up. We are like in touch with them. Maybe they have not still like the final dates from them, and the confirmation is still awaited. But yes, they have in like the principle they have agreed. And this is the plan on the day one. The theoretical aspects will be discussing about the physiology, the myths and evidence in the nephrocritical care. Then there would be some specific clinical scenario, and that would be ending up with the specific clinical scenarios like AKI in sepsis, rhabdomyolysis, hyperkalemia, the sodium disturbances, specific clinical scenario like tumor-lysis, toxicology, liver failure, cardiorenal syndrome, HUS, cardiac surgery associated AKI, CRRT on ECMO, CRRT in a hemodynamic unstable patient, ethical dilemmas on CRRT. Then finally, on the first day, there would be the second half would be the practical. All will be the small group of 30 minutes each. A volunteer to enable the all those like things. There will be CRRT in detail, SLADE in detail, SD in detail, finally ending up with PD. There would be also extracorporeal therapies with CRRT, starting with aquapheresis, plasmapheresis, and cytosurf, and then hybrid modality that ECMO and CRRT, how to initiate different options along with the drug dosing and different practical aspects like venous access, renal ultrasound, VEXUS, and that would be the first day agenda. Finally, the second day would be how to set up a CRRT machine, initiate the CRRT bedside demo, write a prescription, then how to set up a SLADE machine, then renal ultrasound, that would be hands-on, how to optimize the images, how to detect the renal pathology, fluid assessment with VEXUS scoring, and then the second day it would end up with exam, that would be troubleshooting, citrate toxicity, high TMP, hemodynamically unstable patient, and there would be one more exam center 2, exam center 3, exam center 4. So I'm not going into detail of each one, but definitely it would be a very comprehensive nephrocritical care per se. In 2 days, you would be, I think, almost familiar with the most important things. Whether you do it regularly in your ICU or not, that is not important, but definitely you will get to witness some of the best minds discussing about the things at the bedside. Yeah. So
thank you, Dr.
hopefully
Tapas.
we
It
have
looks
many
like a
things
really
coming up.
interesting.
Yeah.
And we need to we are keeping the registrations in a very limited numbers, because this is basically the hands-on training program. So the numbers are very limited. So soon the registration will open. I think they can register.
So all of the faculties, we would definitely secure the suggestions for making this program the one of the of its kind at the national level as well as international level. Yeah.
Thank you, Dr. Tapas. That sounds like a really interesting program with a lot of interesting topics which are important for day-to-day practice of critical care. I hope a lot of registrations, and I encourage all students who are here to join this course and attend this course. It's going to be very helpful. So I think we have no further doubts. So with this, I would like to end today's meeting. And thank you all for joining and giving us your valuable time and valuable inputs, our faculties and our students. It was great to have this meeting, and I hope more and more people enroll this course to take full advantage of this course while their preparation becomes more structured and they pass the exam with flying colors. Thank you all.
Thank you. Thank you all. Thank you, Dr. Mona Lisa.
Thanks.